Hello and welcome to the Destination Zero Year-End Fatality Report and Program Series. I would like to thank everyone for joining me and the National Law Enforcement Memorial and Museum. For the first time, 3 programs will be broadcast featuring one-on-one discussions between distinguished experts designed to provide insight into reducing officer deaths in response to the trends found in the Year-End Fatality Report. This year's series of in-depth interviews will focus on officer deaths in the categories of firearms, traffic, and health-related causes. Our nation's law enforcement officers have encountered extraordinary challenges keeping our communities safe during the pandemic. Today's discussion addresses a profound impact that COVID-19 has had on law enforcement deaths in 2020, while providing resources and strategies to dramatically reduce these deaths in the coming year and in the event of future pandemics. Throughout the pandemic, our nation's law enforcement officers and first responders have been the linchpin of our response. They've worked long hours and stressful hours. They face critical supply shortages and at times sacrifice their own well-being, to continue serving and protecting our communities. It's why I've worked in Congress with my colleagues on both sides of the aisle to address shortages in personal protective equipment, and recently supported passage of emergency legislation that provides funds to accelerate the distribution of vaccines. We owe it to our nation's police officers to provide the necessary resources and equipment to remain safe and healthy. I welcome all of you from around the country and thank everyone for supporting these crucial efforts to enhance law enforcement safety in the line of duty. I would like to now turn it over to the CEO of the National Law Enforcement Memorial and Museum, Marcia Ferranto.
Thank you, Congressman Katko. We are honored to have you as our host this year for the Destination Zero 2020 Fatality Report and Program Series. To all of our law enforcement communities and supporters, welcome. It is our mission to honor the fallen, tell the story of American law enforcement, and keep names off the memorial walls through our safety and wellness programs. Before we get started, I would like to thank Verizon for serving as lead sponsor of the Destination Zero program. As our most valued partner in honoring the fallen and making it safer for those who serve, Verizon's commitment to supporting our mission continues to expand, and we are grateful for their contributions. As the leading authority for line of duty deaths, the National Law Enforcement Officers Memorial Fund has released the 2020 Law Enforcement Fatalities Report. The stringent review process includes agency submissions, medical review, and committee review to qualify the death as an official line of duty death. As of today, submissions continue to flow into our research team, proving this to be one of the deadliest years in law enforcement history. This program is designed to provide you with expert accounts and strategies to help prevent future fatalities in our 3 primary cause of duty death categories: firearms, traffic, and other causes. In 2020, officer fatalities ranged from automobile crashes to heart attacks, and from gunshots to being beaten to death. Of these tragic deaths, COVID-19 related fatalities were the single highest cause of law enforcement line of duty deaths. As of December 31st, 2020, 264 federal, state, military, tribal, and local law enforcement officers died in the line of duty, an increase of 96% from the 135 officers killed during the same period last year. Of the 264 officers who died in the line of duty this year, there were 145 confirmed COVID-19 deaths. It must be noted, however, as the pandemic rages on, the Memorial Fund has a significant number of additional COVID-19 related fatalities in the pipeline under review. Once these cases are finalized, the Memorial Fund projects that the total number of COVID-19 fatalities and the total number of line of duty deaths will grow significantly. Unfortunately, even with preliminary COVID-19 fatalities, 2020 had the highest number of law enforcement line of duty deaths since 1974, when 285 officers lost their lives. Here with us to discuss COVID-19 and how officers and departments can continue to improve their response to the pandemic are Dr. Alex Eastman and Deputy Commissioner John Miller. Dr. Eastman is the Senior Medical Officer at the Department of Homeland Security's Countering Weapons of Mass Destruction Office. In this role, he is responsible for operational medicine across DHS, in addition to countering threats to the United States worldwide. Dr. Eastman is the task force officer with ICE Homeland Security Investigations and is assigned to the Special Response Team program. Dr. Eastman is also a Dallas Police Department lieutenant, the chief medical officer for the Dallas Police Department, and the lead medical officer for the Dallas Police SWAT team. He is board certified in general surgery, surgical critical care, and emergency medical services. Dr. Eastman recently was awarded the Dallas Police Department Medal of Valor for actions taken during the July 7th, 2016 ambush. Joining Dr. Eastman is NYPD's Deputy Commissioner for Intelligence and Counterterrorism, John Miller. The Deputy Commissioner oversees both the Intelligence and Counterterrorism Bureau operations, including the partnership with the FBI, NYPD's Joint Terrorism Task Force, the first and largest of its kind in the nation. John Miller formerly served as the Deputy Director of the Intelligence Analysis Division at the Office of the Director of National Intelligence and as Assistant Director of Public Affairs for the FBI, where he acted as the Bureau's national spokesperson. Before joining the FBI, Deputy Commissioner Miller was the commanding officer for the Counterterrorism and Criminal Intelligence Bureau of the LAPD. Before his career in law enforcement, Deputy Commissioner Miller was a reporter and author, best known for his May 1998 ABC interview with Osama bin Laden in Afghanistan. I want to thank both Dr. Eastman and Deputy Commissioner Miller for taking the time to discuss their experience during the pandemic and how to confront and survive this crisis. To all our viewers, thank you again for being with us and learning with us, because together we can prevent future law enforcement officer fatalities. I turn it over now to Dr. Eastman and Deputy Commissioner Miller.
Great. Thank you, Marcia, for the introduction, and thank you to you, Deputy Commissioner Miller. John, great to be here with you and to see you again. Even though it's virtually, I wish we were sitting around a table doing this. And thank you to the National Law Enforcement Officers Memorial Fund for putting together this series of year-end report webinars on common causes of death among our personnel. And I think this is one today that is, needs no introduction. The effect of COVID-19 on departments big and small across the country and on law enforcement and the practice of law enforcement in the United States, it has been well documented. So I'm glad we're going to discuss this. Before we get started, John, will you just tell us a little bit about your career and it's a really unique background about how you got where you are and today?
Well, it's not a normal career path, but I started out as a journalist covering crime, organized crime, and terrorism. Had the opportunity 25 years ago to come into the NYPD as the Deputy Commissioner for Public Affairs, Public Information. Then went back out to the media, to NBC and ABC News. Had the interesting experience of conducting the last interview with Osama bin Laden in a mountaintop in Afghanistan, and then went after 9/11 to the LAPD to help revamp their counterterrorism program as the chief of intel and counterterrorism there. Then to the FBI, again in public affairs, over to the director of national intelligence, and working on intelligence technology, modernizing that, making it more accessible and collaborative, and analysis. And then to CBS News, and then got pulled back into the NYPD. So I have gone back and forth from public sector to private sector, but more interestingly, or more contrastingly, from kind of the dark side of secrets and operations to the bright side of storytelling and exposing that information. So it's a little schizophrenic, but it's kind of made sense because each one of these ventures has better prepared me for the next. It's somewhat like your very diverse set of skills and how you've applied them from, tactical medic to DHS to all your other responsibilities.
Yeah, thanks. I mean, I think that's I appreciate that, and I obviously watched your career along the way, and we've known each other a long time through major cities and things like that. But coming from a diverse background and going back and forth between two worlds, I think is something that we share in common. And I think every day about how I'm lucky to have been trained in both and to actively practice, both as an active law enforcement officer still and as a trauma surgeon and public health provider. It certainly came in handy. I was, when I came to New York in March at the beginning of the pandemic, sent up by the secretary to come help get some things on track. I was really struck by how dynamic the planning process is in not only in the NYPD, but in the city of New York as well. And I spent a lot of time sitting across the table from Deanne Criswell, rubbing my temples as this was unfolding. But tell me, let's just jump right in. COVID and the NYPD. New York hit so hard at the beginning of the pandemic. Really, the focus of certainly of the country, if not the world. Will you talk a little bit about sort of how the NYPD, how this unfolded, and the things that you saw, and I'll circle back around and give you sort of both the Dallas and the DHS experience when we're done.
It's a really interesting question, especially in this context between you and I, which is the first we ever heard that there was going to be something that would later be called COVID was back when we were calling it the Wuhan flu, was from the Department of Homeland Security. And that's because of the relationship we maintain with Customs and Border Protection. We had flights from China, including people from Wuhan, coming into Kennedy Airport, and they were doing enhanced screening, taking temperatures, asking travel questions to make sure that we could get people examined if necessary, check for symptoms, and so on. And that was the first government agency that told the NYPD, this is coming into your AO, and just to have some awareness of it. It wasn't very long after that we had a hotel by the airport set up for quarantine that was monitored by the city health department. We were watching the numbers very carefully. And then, as we all know, it began this slow motion explosion, if you can take those contradictory terms together, because that's what it was. And when you think about it in NYPD terms, we're a big agency and we're in a big city, but we've never been hit by anything like this before. At the end of today, I think we are 7,154 members of the NYPD COVID positive since, I guess, March 15th. 5 of the 7,000 are cops. A couple more thousand are civilians. And we have tragically had 46, which is a huge number, die from a police administrative aide who worked in a precinct switchboard to a 3-star chief who was in charge of all personnel. And ironically, had he not passed away, would have been in charge of running so much of what we were doing about COVID. So it was massive. If you look at the supply side of it, trying to figure out how to get police officers testing, what to do with their partners who worked in the same squad or the same precinct when one of them tested positive, who to quarantine, who to keep at work, what was the difference between symptoms and exposure, and how to begin deep cleanings of facilities where COVID had touched. So, I mean, I know this is also mind-boggling, but if you look at trying to get a hold of PPE, gloves, masks, we ended up, I think, with 1,250,000 pairs of gloves, 5,000 surgical masks with 3,000 more N95. So let's call that 8,000. I'm sorry. Let's make that million. 8 million masks. So we ended up having as many masks used in this agency and distributed by this agency that exceeded the population of this city. Managing the health crisis, and that's a people problem, essential employees. Managing the supply chain, getting in that much cleaning fluid, that many gloves, that many masks, that much PPE, and answering hundreds of thousands of calls for service every day presented a huge challenge because police departments are in the people business. And when you're people dealing with people in a pandemic, of course, you're increasing the risk of transmittal.
Yeah, a fantastic point. And I think taking my, DHS hat off and putting my Dallas Police Department hat on, I think the true unsung hero of the pandemic, who you don't think about and talk about it until you get to this level where you're trying to run it for a big department, is the whatever you call the financial services and procurement person in your department. Because like the NYPD, obviously on a smaller scale in Dallas, the idea you have to procure, get into the PPE marketplace where you're not sure what's legit and what's not. You got to make sure that you've got the right stuff for your personnel to feel safe, to be able to function. And then when everybody else is clamoring for the same supplies you are and the same ability to clean things and make things safe, that procurement team and the financial services guys were invaluable. And so I think that's for me, a clear lesson learned that would have been something that I didn't expect. And at DHS, we've done a lot of work in the supply chain to make sure that there is appropriate integrity in the supply chain, because you want to know that when you order a million, New York City orders 1 million N95 masks, that you're going to get actually N95 masks that work. And so I see you look like you're on the edge of your seat to talk about the supply chain.
I mean, it's the reason it's also interesting is because we as a business, and I'm not talking about the NYPD, I'm talking about all of us, have never been confronted with something like this before. Mm. We went through the venture here with DHS and Health and Human Services of an Ebola set of infections that occurred here, going back to, I think, 2015 or something like that. But that was about containment, about tracking, about protocols. It wasn't a massive thing sweeping the city like this was. So when you talk about that supply chain, you're walking, you're chewing gum, and you're whistling at the same time. Because not only do you have to keep serving emergency calls and calls for service, but you're trying to do that buying. And then you're trying to, are these masks actually going to get here? Are they actually what they say they are? The thing that brought me to the edge of my seat is the mayor asked the former police commissioner, who works for Visa MasterCard now, Jimmy O'Neill, to come back and to sit in Office of Emergency Management, OEM, and personally kind of take charge of the supply chain. He said, the current police commissioner, your successor, has his hands full with dealing with his people and the people of the city. But we need somebody who knows about large bureaucracies and purchasing and so on to do this. And Jimmy came back and took that over. So he was not only trying to locate the material, get the material shipped in, but also using his very good nose for detective work to make sure there wasn't fraud involved, we weren't being had, that the money was going where it said it was going, and that the stuff was actually coming in return, and so on. And that became a big deal.
There's some great tales from the early days of the pandemic in New York City that cannot be told on this webinar, but I had with multiple exchanges between Terry and myself and in all directions to get New York City, really what it needed. How for us in Dallas and certainly at DHS, the pandemic has not just affected our personnel, but it's really affected the way that we do things, trying to make things safer. One of the things that we instituted early on in the city here in Dallas was to really change some of our tactics, to enter less people's homes if we could do that, and to stay outside and away, and try to make the job of being, a patrol officer as safe as humanly possible in the face of this pandemic. It's not just about PPE, but about how you actually do the job. So what things were done in New York City that helped y'all? 7,000 people is a significant chunk of the workforce. Here in Dallas, we've had about 12% of the workforce contract COVID, and so that puts a dent in what you can do. What have y'all seen that's in terms of changes in operations that have helped in the city?
So a couple of things on that, Alex. I mean, number one, our normal sick rate as an organization is between 2 and 3%. On a daily average, we hover about 2.5, 2.7. We don't get alarmed at 2.8 or 3%. At the height of this, we were at 19% out sick. So, we were hurting for people, and our people were hurting. Second piece was we started to say, all right, let's get non-essential workers to not come in. But we don't have non-essential workers. We're the police department. Everybody has an essential role. So we had to reframe that with is everybody's essential, or almost everybody, and they all have to work. How many can we get to work from home who can still accomplish the essential parts of their job and do that seamlessly? So we had to set up connections, Zoom calls, Teams meetings. We had to supply equipment in some cases. In other cases, we could leverage what they had. But we had a significant part of our workforce who were not on patrol, from administrative people to my own intelligence analysts. They were able to work from home on an unclassified level. When stuff hit the high side, they had to come in. And that was, I think, a giant factor that kept kept more people safe, less people from getting infected, less contact with the public. But then, as you kind of started this point, there's the mechanics of, answering 10 million calls for service that come in every year. And that meant entering less residences, as you said, which is you'd go on a call. What could you deal with from a distance? Did the officers have their PPE on? Could they offer PPE in terms of a mask or glove to other people if they had to make an entry, which often they did? What medical questions could they ask about exposures and so on? And then the cleaning up afterwards. One thing that you just don't expect is when they were being sent to, let's say, an emotionally disturbed person or a domestic incident where someone was COVID positive, because we did see an increase in domestic incidents with everybody locked up together at home. Normally, we would put that over the radio and so on. That became one of those things where we call it a 10-3. You got to call the dispatcher, because this is a funny thing about police work, putting the domestic violence, putting out the emotionally disturbed person, that goes over the radio all day. But putting over someone's medical information with their address, which someone could extrapolate a name from, actually we felt began to rub up against HIPAA. So we would say, give the dispatcher a 10-3, and then she would give you the information about what was stated about COVID in the house, whether it was the perpetrator or the victim or somebody else. So we had to find new ways to transmit information about this in considerations of things like HIPAA that are normally outside our discipline.
It's a great introduction to where what I want to talk about next, which is communication. And I appreciate your acknowledgement of the CBP team there at JFK. Our office, the Chief Medical Officer's office, and the Countering Weapons of Mass Destruction office at DHS has been intimately involved in the airport screening program and setting it up and moving it forward and replicating it. And so I appreciate the comments about communication. I think one of the things that struck me as I traveled the country earlier in the pandemic, and literally everywhere from New York City all the way to Northwest Alaska, was how, and we talk about this a lot in the federal government, and we do it well most of the time, about how the disparate component agencies speak to one another and actually communicate. And I will tell you that when I got launched into New York City, the first thing I did like a cop was call my cop friends and called Terry Monahan and said, "Hey, man, brother, I'm coming to town with this crazy assignment. How can I help you do things better?" And I think so much of what we do this is a relationship business at this level. But for departments that don't, have that communication, capability, what do you think are the critical pieces of communication, both not only within the department, but outside as well? And I will say this, to be very transparent, NYPD has always had such a lead role in law enforcement in the United States, not only in terms of the Sentry program and communicating with people and making sure that you guys are in places, the men and women of the NYPD are in places that other police departments, municipal police departments, just simply are not. So let's talk a little bit about information gathering and sharing as it relates to the pandemic, and sort of what you think the biggest lessons learned on that front.
That's a great point, Alex, because, the NYPD story is remarkable because of its scale, but we should be scaling to, the police departments of America, most of which are not the NYPD or the LAPD or Chicago PD or Philadelphia, where the numbers are in the thousands of police officers, but places where the numbers are in the 1200s or the 400s or the 125. That's what most American police departments look like in the cities and towns that make up the 17,000 law enforcement agencies that amount to the 850,000 lawmen and women in this country. So assuming that they don't all have their own medical division and their own, quartermaster section that, is buying PPE literally in the millions. I think what we applied to this was the same principles we applied to crime, because they fit perfectly. When we said, what do we need to attack this pandemic so that we survive it as an agency and our city survives it as a populace, is what do we need? Timely, accurate intelligence. What are the facts? Where are we getting them? How are they vetted? That requires partnerships with your local health officials, your local hospital officials, and your federal health officials. That was essential. Timely, accurate intelligence is followed by rapid deployment. Once you have that information, how are you acting on it? Are you buying the right things? Are you getting to your employees the right equipment in terms of PPE? Are you giving them the right instructions as to how to protect themselves? And are you putting that out to the public so that they have the same information about how to protect themselves? Timely, accurate intelligence, rapid deployment, effective tactics. Are those things the things that work? Early on, because we were following the timely, accurate intelligence from our federal partners, the idea was that this was surface-borne. You could get it off of smooth surfaces, tabletops, countertops. The focus was on gloves. It was on, cleaning your phones and your screens. We blew up a lot of VoIP-operated phones by spraying cleaners on them and having them short out. But were they effective tactics? Later, as the medical intelligence became better, our tactics shifted to, yes, gloves, but more important, masks for everybody, not to protect yourself from taking in germs, but to protect others from what you're putting out. So we were able to shift as the intel morphed. So timely, accurate intelligence, rapid deployment, effective tactics, and then relentless follow-up and assessment. For us, the relentless follow-up was to get the cops to wear the masks all the time, because in the land of unintended consequences, and isn't this everybody's lucky year, of course, we had a new police commissioner who was first greeted with pandemic, and then George Floyd protests, and then riots and looting. And it is very hard to maintain that level of mask wearing discipline when it's fogging up your face shield on your helmet or your glasses, and you need to see, and you're in large crowds, and there's all kinds of emotional pressure and tension. But we just hammered away at the wear your masks, have the supervisors enforce that, make sure that we, the bosses, are wearing our masks so we don't send the signal that you don't have to. So partnerships, intelligence, tactics, deployment, and the relentless follow-up on all of that is scalable to any department and any size. The partnerships may be different depending on the size of the department and the nature and structure of the county or city government, but you cannot operate in a vacuum.
Yeah, I think your point, first of all, the intelligence, the information sharing points are spot on. And I think that, you know, as I look back on my own performance during this and the things that I could have done better, I think, you know, at the beginning, we all fell into the same trap of we didn't know that much about this disease, and focusing on surface and cleanliness and things like that. Really, I don't want to say it detracted from the message of wear your mask, because as we learned more and evolved, we certainly evolved with the times. But for me, it's been really hard to communicate with my brothers and sisters in law enforcement at all levels the importance of wearing a mask. And then when the idea of wearing a mask got, you know, for lack of a better word, politicized, and people started looking at it as an individual rights issue, you know, then it becomes even more challenging. And certainly I've had a number of spirited discussions with law enforcement at officers at many levels around the country to try to convince them to do exactly what you said, which was, you know, listen, just wear your mask at all times. It's the best defense we have, right, you know, at the time. Obviously now we're in the first few days of a vaccine rollout, and I think we've got some other weaponry against this virus that's going to get us through this, and hopefully, you know, in the next coming months, put this to bed, and we can prepare for what's next. I want to, again, let me shift gears again. This has affected all of us personally in a very profound way. I think we here in Dallas just lost our first officer from COVID-related complications a few weeks ago. We had, I think everyone, you know, certainly putting my healthcare provider hat on, you know, every time I work in the hospital, currently I still see, you know, tons of COVID patients, and I've had family members who have had it, and close friends who have perished from it. You had your own experience with it. So if we can, without, I don't want to breach your HIPAA confidence, but if you talked about, you know, a little bit about the personal toll, I think it's really important for people to hear.
So you know, I am one of those people who will not go to the doctor unless my arm is actually falling off or something. And I wasn't feeling well, and I knew to isolate myself at home. But you know, I think one of the kids had it first. We didn't know what it was. We got her tested. Then my wife, then me, and you know, I'm one of those people who's in that zone of, you know, the 60-year-old crowd where, you know, you have a built-in vulnerability that comes with age. And you know, I wasn't going to the hospital, and she was taking my oxygen levels on the pulse oximeter, and it was going dangerously low. And she was on the phone with the doctor, and the doctor said, he said, "I'm sending an ambulance to your house." And of course, you know me, all I'm picturing is like me being taken out on a stretcher in the lobby, and neighbors, ambulance. So I said, "I'm getting in my police car. I'm going to drive myself to the hospital. I'll be gone before the ambulance gets here." So basically they threatened me into it. And And I drove to the hospital and I parked the car and I got back into it 6 days later. And, luckily it didn't get towed away, but it was, when you get into that hospital and you're on that oxygen and you're hooked up to that monitor and you're watching your own oxygen levels go up and down and get worse and better, and they're trying different cocktails of experimental drugs that they don't really know which one is going to do the job, or if any of them are going to do the job, or if it does the job, which one it was. And the guy in the bed next to you sounds like he's not going to make it. And they're talking about shortages of respirators. It was a very heady experience. It's also the one that made me very grateful to first my wife, but also my doctor for basically blackmailing me into going to the hospital.
I was going to say, you need to make sure your wife has my cell phone. If God forbid we repeat this, I'll come get you myself and drag you there.
Cuffs, please.
No, I'll be gentle, I promise. But the thing that struck me so personally at the beginning of this was, I was minding my own business working with the airport program when I got drafted to come help the response, and 24 hours later was standing in the ICU at Jacoby, struck by the profound volumes. And it was really the first place in the United States where anyone saw infections at this volume. And there's a number of reasons, from a public health standpoint, why that happened. But I remember standing with a dear friend who's the chief of trauma at Jacoby, Sheldon Tepperman, and we were looking at one of his nurses who was one of the first healthcare providers in the city to get it, and she was not doing well. And he looked at me so forlorn and defeated, and just leaned over. This was like in the beginning, and no one was touching anyone and no one was hugging anyone. But he leaned over and just hugged me and started to cry. And I was like, man, this is like a stoic trauma surgeon, overcome by current events. And I think, for so many of us that have been now doing this for, since the spring, your personal story is really one that helps, I hope a lot of people understand that there is life after this, and we will all get
Alex,
through this.
the key to life after this is to don't be me. Don't wait till somebody makes you go. I know other people who are in my age group who waited longer and ended up going right onto a respirator. And as you know, from those days at Jacoby, only 20% of the people who went on those respirators ended up walking out of the hospital, either because it had moved too fast, or in many more cases, they had waited too long to go to the hospital because they thought, I can beat this thing, eventually it'll go away on its own. You got to go.
No question about it. This is like I said, it's not a different disease, but the treatment of it now, we know so much more than we did, early on in the process. And I think that's key. Getting seen and treated and some of the therapies on board early is huge.
And I think some of the things, because I think one of the values we can provide here, especially as an agency that lost 46 people. I mean, you talk about people who had comorbidities. We saw higher death rates among people who were overweight, suffering from diabetes, asthma, other things that gang up with this disease. But then, you take Bill Morris, our chief of personnel. He was the picture of health. Skinny as a rail, regular runner, motorcycle rider, active guy. Who just who had it and had it bad, and went to the hospital, relatively soon after that. So I think if you look at our testing now, since March 12th of 2020, we have had 7,154 people tested positive, 5,700 negative. So let's call it half and half of the 14,000 people that we've tested. But what we're doing now is we did a big push, and testing costs money. We worked with the health department and the city's hospitals to find city funding to say any cop who wants a test should go get a test. Any police department employee, if you're not a cop, should go get a test, because we're all exposed to each other as well as the public. Did a big push before Thanksgiving, Why? Because we wanted to see, before you go into those big family groups or travel to big family groups, if you're carrying and you are not symptomatic, you need to know that before you go and mix with other people. We're doing another one, hopefully starting now, before Christmas. Same reason. You know what we want to do after that? Do another one after Christmas, just like the before Christmas one will cover us for after Thanksgiving, so we can say who went into this tested and fine and came out with it infected but not symptomatic from another family relative who didn't know that they were carrying it when they got together over the holidays. So we're trying to bookend the holidays with mass availability of testing for our people, so that we can continue to do as best we can to limit exposures and transmittals.
Yeah, great. Fantastic point. The key as we emerge from this in the coming days and months, or days and weeks and months, availability of testing on a very wide scale, which is now, we're to the point where it's far more available than it ever has been at any point in the course of the pandemic. Encouraging our personnel to not be skeptical of the vaccines that are coming down the pipeline and take those vaccines. And the thing for me that I worry about is, what are we going to do? People are going to look at the vaccine as a panacea, and you have to, continue some of these measures, masks and social distancing, until you get enough folks that have taken the vaccine to have, some herd immunity in your community. I think we're drawing short on time, so I want to just give you a chance to what sort of last words of advice or resources you think are critical for law enforcement out there to look at as they continue to manage COVID-19.
So before we go, I'd like to almost pivot. It's still related, but to talk about the crime and the terrorism piece of this.
Sure.
Which is, we saw interesting rises in violent crime while we were seeing declines in crime, because tensions were higher. The populace was less out on the street. We saw many more burglaries because places were closed. We saw many more car thefts because cars were left unattended for days and weeks at a time from people who were quarantining or staying inside. On the terrorism side, there was no let up in that, and you'll appreciate this especially, Alex, because it's about the triangle of partnerships. The great hospital ship came into New York when we had no beds and no ventilators, and it had a giant red cross on it. And it came into our harbor, and it was our backup system. We put, hundreds and hundreds of beds in the Javits Convention Center on standby for hospital overflow. And at the same time, ISIS and Al-Qaeda were putting out propaganda saying, America is down on one knee already from this disease, which was sent to them by God to make them pay for their awfulness. But a simple attack on a hospital emergency room, on a government location, while they're in the throes of this pandemic, would cause massive panic and fear. And, we call on our followers to strike. They were looking for those lone wolves. So we still had the challenges of crime. We still had the very active and tangible threat of terrorism. And when you look at the target set, the Javits Center with hundreds of beds and military medical personnel, a military hospital ship in the harbor, which is a government target, a COVID target, a high publicity symbolic target, our CRC units, Critical Response Command from Counterterrorism, we put a blanket of officers with long guns at checkpoints around that hospital ship and the Javits Center to make sure if a terrorist tried to follow that call and went to look around, this was going to be a hard get. So those things never let up. Just to close on lessons learned, usually our lessons learned model is, we've done this for years, but this time it was different. And, we learned these lessons. We've never done this before. So what we've packed up is most of what we did seemed pretty right. We learned as we went, and to take that and keep it packaged. Make sure those supplies are still around. If this or something like it comes around again, trying to buy that on the fly was a big challenge. Make sure that we get that timely, accurate intelligence, rapid deployment, effective tactics, relentless follow-up and assessment, ingrained into the health end of this as well as the policing end of it, because it works for both.
Awesome. And just to bring this, yeah, like you said, full circle, I think the crime, New York City, not alone in seeing the unforetold effects of an increase in violent crime while with an overall decrease in crime. City of Dallas, very similar. And other major cities, when we recently met all the chiefs together, saw similar trends. And I think those are the things that we'll be studying on the law enforcement side for years to come. Just in terms of resources, we put together a package, a resource guide at DHS, our Office of Partner Engagement, Assistant Secretary John Hill helped put together a resource guide that is available to any department out there, that will get you the things you need in one place if you're still having COVID-19 issues. And then, I'll say this too, I'm lucky. I've got the best job in the world right now. My boss pretty much lets me engage with, any state and local entity that I need to provide that assistance. And so, certainly on behalf of Acting Secretary Wolf and on my Dallas Police Department boss, Acting Chief Anderson, really, if there's a department out there that needs some technical assistance, if you can't get over a hurdle, if there's something that you need, please don't hesitate to reach out, because like the Memorial Fund, like the NYPD, all the folks that I work for are committed to making sure that this job is as safe as possible. Last word, sir.
God bless everybody who was here to help, from every entity of the federal government, our state partners. God bless those who got this disease and came out the other side okay. And God look over those who, the 46 of whom from the NYPD lost their lives, and hope that there are no more like it.
Well said, sir. And to all of you who joined us today, thank you for your commitment to making sure that this job is as safe as can be. And I think all of us look forward to the day that we don't have to have any more end of year reports from the Memorial Fund. Thank you very much. Stay safe out there.
Thank you, Dr. Eastman and Deputy Commissioner Miller. Your personal experiences during this pandemic have provided us with a unique opportunity to learn how to prepare for future crisis and support officers during these critical moments. You have shown us how important we all are in this fight against COVID-19 and keeping our officers safe. Again, I would like to thank our corporate partner, Verizon, for helping us keep officers' names off the wall with their commitment to our mission to making it safer for those who serve. In an effort to provide this life-saving information to as many officers, departments, and agencies as possible, you can access today's discussion anytime on our website and our social media platforms. Thank you again to Congressman Katko, today's guests, and to all of our supporters. To our law enforcement officers, stay well and be safe.